Okay, parents and guardians, for those of you who are looking after a child and they are choking, there's an earlier video where I showed you how to properly do the abdominal thrust for a conscious child choking. Now we're going to presume the foreign body object did not become dislodged and the child then becomes unconscious and is not breathing. So let's go back to where he was still conscious. You're above the belly button, which is right there. You're going to be pushing, remember, you're pushing in and up. Now if he goes unconscious, you're going to carefully lower the child to the ground, because at this point he is not breathing, and you need to therefore look, listen, and feel. You want to look, see if the child is in fact breathing, look for chest rise, feel maybe for any air movement coming out of the mouth, which there is none at this point because it's still lodged in his throat. So you're going to attempt a rescue breath. Position the child's head as so. Close the nose, place your mouth over the child's mouth, and give a rescue breath. At this point, if the breath does not go into the child, you will then come to the chest with one hand and do CPR on the child's chest, 30 to 2. So you're going to do 30 compressions and attempt 2 breaths. Continue this until EMS arrives or the object becomes dislodged. Okay, you can also, in between compressions and breaths, look in the child's mouth and see if you can visually see the object in the patient's throat. If you do, use a finger hooking motion and sweep the object out of the patient's mouth, and then give rescue breaths to then stimulate the lungs to continue breathing again. Okay, if you have successfully removed the foreign body object and your rescue breath attempts have successfully been administered to the child without resistance, continue those breaths until you regain consciousness of the child. Make sure you feel for a carotid pulse. If there is no pulse, continue chest compressions and rescue breathing until 911 arrives. If you did not remove the foreign body object, continue the chest compressions, 2 rescue breaths. Continue to look in the mouth. If you see something, sweep it out with your finger. Now I want to remind you that first and foremost, before attempting this procedure, you need to call 911 and make sure they're on the way. They have special equipment that can further save this child. Okay, now one thing to remember when you're doing rescue breaths on both an infant and a child, keep in mind that as adults, our lungs are much bigger and we do not need to exhale all of our air into them. You can actually do more damage than help. So remember to just look for proper chest rise and fall when giving rescue breaths.